good evening and welcome to Health Quest. I'm Deborah Arneson, your host once again tonight. And tonight we have a wonderful show, not for women only, but certainly geared towards our women viewing audience. And tonight we're going to be talking about hormone replacement therapy. Do we need it? Do we not need it? What are the pros? What are the cons? What are the risks? So tonight we have a wonderful guest who's taken a portion of his time out of his day to be with us and share this really interesting, necessary information with us, especially as so many of us baby boomers are starting to segue into menopause. So tonight we have Mr. Carter Black, who is a compounding pharmacist, and there is a difference between compounding pharmacists and regular pharmacists. So thank you for being with us, Carter.
Thank you.
It's a pleasure to have you here.
It's nice to be here.
So tell us a bit about yourself. How on earth did you ever come to be a compounding pharmacist?
Well, I wanted to be a compounding pharmacist. I've been in the field for 25 years, and it's kind of a specialty practice. We are just like a internist might refer to a surgeon for surgery on an appendectomy. Other pharmacists or doctors or nutritionists would refer to us for nutritional support, or if there was a compound to be made for a patient. In other words, something other than a set dosage form. So you like the actual kind of Merlin magic about it. You're actually doing very user-specific prescriptives for people rather than a set kind of staid prescription, which is generic for all people. Right, right.
Yes.
And it's a thing that, you know, I can solve the patient's medical problems, and I get a chance to get involved with the patient, and that's a very important thing with me.
That's wonderful. So, and one of the things that's wonderful about Carter and in dealing with him, with my women, he is more than generous with his time. You allow the women to call you and have conversations with you, and you work with the doctors, with the nutritionists, which is really unusual because we know in this day and age of craziness, it's hard to find a professional in the healthcare industry who takes time, plain and simple. So that's one of the reasons I have enormous faith in what he does, not only because he's a wonderful compounding pharmacist, but he cares, which is amazing. So we're pleased to have you. So how can a compounding pharmacist help women?
Well, basically what we can do is we can be a referral source. Also, we can fit the medication to the patient. So many times in a prescription, the woman has to take what's available, and that's not always necessary. Women today are very individual, and we like to put something with the patient that they have a chance to be successful with. And the idea of fitting the medication to the patient is important.
I think that's very important, especially when it comes to something like hormones, right? I mean, we're looking at a very unique, everybody is so unique biochemically, so of course, you know, I may need more of one type of estrogen than another woman, and most women don't even know there are 3 estrogens that we basically test for. So I may need more estrone or estriol or more progesterone or testosterone, and a standard prescriptive would give you a certain set dosage of usually just progesterone and estrogen, right?
Right.
And no testosterone.
That's right. Well, what we can do is we can provide counseling to the patient. Also, we're available and accessible. We have a compounding practice that is open about 80 hours. So, you know, it's a long time.
We're there,
yes.
Come rain or shine.
And we're one of the most accessible of the healthcare professions. So usually someone can get an answer to a prescription problem or question
Almost
most of the time.
Yeah, that's great. Well, it's interesting, too, because even in my practice, being a clinical nutritionist, I clearly see that the patient, by and large, is very trusting of pharmacists far more so than their physician because of availability in good part, I believe. You know, it's like nice to have someone who you can pick up the phone and they'll talk to you and answer a concern or a question. Because when the concern is there, it's usually imminent. You need the answer quickly because you're in a position of like, what's going on with my body? What is this drug doing? How should I be feeling? Is this normal? You know, so.
And we provide a lot of triage that way. We try to find out if the patient's in immediate need. They need to go to the hospital, or they need to call their doctor, or we need to call their doctor for something. So it's really, if you become a pharmacist, you have to have a lot of compassion, and I wouldn't recommend anyone go into field at all.
If you're not compassionate.
That's right, because the hours are long, but it is very rewarding.
Yes, it is. To see people come to a place of wellness is always very gratifying, I know. So what are the benefits of hormone replacement therapy, in your opinion, Carter?
Well, there's immediate health benefits, and then there's long-term health benefits. We try to factor in age, family history, lifestyle, nutrition, present conditions. Age is an important one. Where are you in your life? Are you premenopausal, perimenopausal? Even teens can benefit with hormone replacement therapy. Teens have a great deal of PMS, and it's not recognized, and it's kissed off as something, you know, oh, that's my daughter, or that's my, you know. Then when you're pregnant, there's help we can give to become pregnant, also to support the pregnancy. Some of the biggest benefits we've had is to prevent spontaneous abortions by women that are pregnant by supporting the endometrium with progesterone. In the Middle Ages, that's the age of PMS. Perimenopausal, and I say more, that's a real adjustment period when you're just starting to lose your estrogen.
And that starts approximately what age, as far as what you're seeing now in America?
Well, actually,
younger.
It's really younger, anywhere from, you know, the early 40s, and we're even seeing some very late menopauses too. So the ranges are so big, and that's why we're going to talk about some testing later. But postmenopausal, obviously, that is a time when we need to think about supporting the woman with maybe some estrogens, progesterone, testosterone, a few things.
So the question I have for you, and this is something that we don't have here on our list of questions to ask, and maybe you can put some light on this subject, is are you seeing more and more hormonal disruptions or imbalances? And if so, which I'm sure you are, but if so, in your estimation, does it come from a lot of the pesticides and the endocrine disruptors we're all exposed to in our culture, in our society, in our agribusiness, in our food chain?
Oh, absolutely. I mean, that's called false estrogens. They have a name, xenoestrogens, or but what they're doing is they're locking on to a woman's estrogen receptors, and they're not letting them go. And we're seeing so many different types of symptoms of like false estrogen overload when it's not there, causing all kinds of health problems.
Do those false estrogens show up on a hormone panel test?
I haven't seen that, no.
Can you tell if it's really estrogen, or is it the fake estrogen?
Yes, that's why a good history is so important. And also, not only just a history of what's going on, but also what's your lifestyle like, where do you live, you know, do you live on a farm, you know, or out in the suburbs, and do you have one of those lawn services, or does your husband fool around with the chemicals out there? I mean, what's going on?
Do you drink tap water?
Do you drink tap water? What's your nutrition like? You know, fast
How much
foods.
coffee do you drink to reach
absolutely.
things out?
So it's a very interesting effect that the women are getting.
And it's a huge industry right now, again, because so many women are starting to segue into perimenopause, and menopausal flux is younger and younger. So, and again, the standard treatment, if we can create some clarity for a viewing audience, is that, you know, it's either to do or not to do for hormone replacement therapy. And what we're trying to do is give you a venue or an avenue to show you that there's an alternative that's very user-specific, so you don't have to take a generic prescription for estrogen, which is not, in fact, oftentimes the type of estrogen you need, or progesterone, and it may be too much progesterone or not enough progesterone. So you can do, you know, a test or a series of tests that will allow you to seek the help of someone like Carter, who's a compounding pharmacist, who will create prescriptive cream or sublingual,
Sublingual, we can go
drops under your tongue that are very, very specific for your body. So you're not taking a generic hormone replacement, which is so silly.
Well,
and you see a lot of weight gain in women who do that too, because they're getting too much of the wrong one, right?
It's out of balance. And that's it's something that we need to determine by, as you were alluding to, saliva tests and a great history. This is the way that we can really get an idea of what's happening with the women.
Well, how do you determine someone needs a hormone test or replacement therapy even? So you determine they need the test because why? They come to you with what types of concerns?
Well, obviously, if you have no problems, you're going along fine, you're not going to seek my help.
So if energy is good, you know, if your bowels are moving fine, if you're not moody and crying and explosive, and or if you're working out, like I have women who work out a lot, but they can't build muscle, which means sometimes what? More estrogen, not enough testosterone?
Right.
Could.
It is. Weight gain, all kinds of things. Depression, urinary problems, sexuality, everything goes into the mix. And obviously something is not right or something is broken when they come to us. So what we have to do is we have to do a very good history, and usually we use saliva tests.
Okay.
And saliva tests gives us a good picture of what's going on, especially if we can get them during different phases of the woman's cycle, if they're cycling.
So you would test during, like, how many phases of the cycle?
I would really like to see all phases, the luteal, the follicular, and also during the menses.
Okay.
To see.
Because it fluctuates so much.
Yes, and if the woman will go along with this, so that we could have a baseline, and then, you know, a few months later, after we've done some treatments, after we've done some adjustments, we don't always have to go to the natural hormones right away. We can try a few other things before we do that. Some women are hesitant, and that's fine with me. There's nutrition, there's herbs, there's all kinds of health.
So would you literally do a hormone test on anybody who was presenting with these types of problems over a blood test, and if so, why?
Well, blood tests really just give you a snapshot. They really don't give you a sense of what's going on with the women, and let me explain why. Saliva tests give you the unbound hormone that's in your body that's acting on your body.
It's called the free fractionated?
The free fractionated hormones.
Okay.
Okay. All the other hormones are bound and they're not active. So if we really want to know what's going on, we don't take a blood test, we take a saliva test.
Okay.
Then we can tell what is going on with a woman, and then we can...
So bound means they're being used?
No, bound means they're not being used.
Okay.
The free
means they're being
means
used.
they're affecting tissues.
Okay.
And they affect every tissue in your body. I can't name it. Absolutely.
The thyroid,
eyes,
the breast,
you know, everything. So we're not going to see any effect on a bound estrogen or progesterone or testosterone.
So that gives you nothing other than a snapshot of what's bound up.
Right, if it's a blood test.
Okay.
And so many physicians are relying on these blood tests. That's why you're going to need to do some research on your own and possibly school your physician on this.
And tell him that you're interested in doing this.
Right.
Because most doctors, it's been my experience that most physicians will do what they're comfortable doing and what's been embraced by their associates for the most part. But I think Dr. Christine Northrup has brought the most information to the table with her hormone panel tests, and she uses the University of Madison, I believe, for her lab. And I think there are 2 or 3 in the country that do these assessments, right?
Well,
major ones?
Right. If you get on the internet, or if you would ask you or I, we could give you resources for saliva tests.
Right.
And I'm sure that your physician's been approached either by his patients or labs wanting their participation in this effort.
Sure. So it's a matter of like expressing, getting the information, going to your doc, and then telling your doctor that this is what I'm interested in, and please call Carter, because he'll explain it to him and why it's so great, right?
Well, I can give you some resources, and I can point you through some of the mazes that you will, but you do have to be self-assertive as a woman. You have to read
Educate.
If your doctor isn't open to this, then you need to work with him to open his eyes.
Mm-hmm. Or find someone who's somewhat receptive.
Yeah, we hate to see that.
Yeah, if you have history with someone, it's really important. But again, I think it's also important as a healthcare professional to, be open to the possibility that there might be some things you're not familiar with.
Right.
And if, my belief is if you can't help someone, refer them to someone who can.
Absolutely.
So, and that takes a little bit of ego aside. It does.
Yes.
So, what are the options to hormone replacement therapy?
Well, I think what you have to do is you have to look at your mother and your aunt and your grandmother to see how they got through this whole thing. That's very important because
when they started menopausal symptoms, the symptoms.
Right, right. Okay. And what do they look like now? Did their bones hold together? Okay. I know you're not going to discuss sex with your grandmother, but some of the other
mine
things.
would have been, honestly. So my nanny would have said,
well,
Deborah.
Well, they didn't do that at that time.
Right.
But you have to look at your genetics. And sometimes you can do just nothing at all, and you will find that maybe you'll get through it. The other thing you can do is exercise, lifestyle, nutrition, all of those types of things.
Why is exercise so important, Carter?
Oh,
just walking is helpful, correct?
Well, oh yes.
Okay.
Well, stress, number one.
Yeah.
Yeah, stress. Number two, you need load-bearing exercises to prevent osteoporosis. So, I'm sorry to say, but swimming isn't going to do it for you.
Right.
You've got to get on your bones and use them.
And move them and push them.
That's right. So, walking is wonderful. Jogging, is a little stress on the joints. Biking is okay. But all of these things, exercise, the things that you eat. Also, I can't tell you anything about soy products.
Oh, sure you can.
And then the nutritionals that are out there, and some of the herbs that are
available.
Yes, and they have estrogens in them. So we have to look at other societies and what they're doing.
Gosh, don't you think it's important, though, Carter, that people who decide to do herbals do organic herbals? Because, again, we're looking at pesticides on herbals.
Well, absolutely.
And the soy should be the non-GMO, the non-genetically modified organisms?
Oh, absolutely.
Because of the Roundup.
Yeah, absolutely. So we all have to be very conscious of where our herbs come up from, where our drugs come from. Right. There's progesterone creams that you can buy without a prescription, and there's a wild yam cream. Well, unfortunately, wild yam is never converted to progesterone in your skin, so it's not going to work. I'm sorry to disappoint anyone. If you're getting something out of it, that's the psychological boost. Well, God bless you.
Well, isn't that interesting? I wasn't aware of that.
Yes. And also, some of the over-the-counter progesterone creams are uneven in their quality. We make a progesterone cream that's very important for PMS symptoms, fibroids, things like that. So, and I know that my quality is good, and I ensure it. I wouldn't be doing it if I didn't.
Well, it's like anything. It's like you put, unleaded gas or leaded gas in your tank. It's like, what's it going to do to your engine here? So that makes sense. So tell me this. Why do you suggest natural hormone replacement therapy?
Well, for so many reasons. Why have the woman fit to the treatment rather than have the treatment fit to the woman? Right. Obviously, you want to take the estrogens that are natural to your body. Right. Why would you put in something that's not normal? So many of the chemicals that are given out right now to women, and I'm telling you they're chemicals, not really hormones, because they are converted in a lab, and they are not,
natural compounds.
That's right. They have to be converted in your body to your hormones, and then after that,
maybe you'll use them.
That's right. They don't lock up to the receptors properly, and there's all these metabolites. that
which are
are
toxic.
that are running around and can cause you problems. And now think of
Like
this.
what kind of problems?
Well, think of this. You cannot take the synthetic progesterone called a progestin in pregnancy. However, I do a big business in progesterone supporting the endometrium. Tell me why.
Tell me why.
Well, because the synthetic progestin is not, it causes birth defects.
Oh, gotcha.
So,
So people need to be aware that there's a huge difference in the quality of products, and you need to go to a compounding pharmacist who has integrity, probably a good idea, versus something sold over the counter that is questionable as far as quality and efficacy and assurance of safety.
Right, and not and fitting the treatment to the patient, not fitting the patient to the treatment.
Right.
There's so many women accepting hormones from their doctors. Now, there are a great deal of women that's successful in.
Right.
And they're very successful in treating vasomotor problems, the hot sweat, you know, the sweats, da-da-da. But when you start thinking long-term and thinking of all the metabolites that are going to be in your body, you ought to think about, should I have my own estrogen in my body, or should I have something that was made in a lab?
Right, right. So what are the most important hormones to replace for women?
Well, estrogen, obviously. Progesterone is very strong. Actually, progesterone is the oldest hormone of any hormone that we have. It's present in all animals.
It is.
Yes, not
it
necessarily a sex hormone in other animals. It's good for glucose metabolism. But
does progesterone convert to estrogen if needed in the liver?
oh, absolutely.
I read that somewhere. Okay.
Absolutely.
Providing your liver is working well enough to do so.
Right, right. There is a very fine balance with hormones. And there's a cascade between all of them. They will metabolize between each other. So what we need to do, we really need to find out if there's an excess of one, a lack of another, or if everything else is just down. And that's why the saliva tests, again, are so important.
So valuable.
Right.
So we're running out of time. We have just like 5 minutes left here. So what's the downside of hormone replacement therapy? Is there any?
Yes, there is. And obviously, cancer is a problem. I would say less so with natural hormones, but more so if you don't do anything, you have a problem with heart attacks and osteoporosis. I mean, you have to realize as a woman that breast cancer isn't the biggest killer of women. Okay, it is heart disease, and so many women are not treated fully for heart disease. So estrogen is a helper to prevent heart disease, osteoporosis.
Which type of estrogen? Because there are 3 that you examine when you do a saliva test, right?
Right, right.
So which one is it?
Estrone, we try to eliminate estrone. There is formulas that don't have any estrone at all. And a little bit of estrone does get metabolized from the other estrogens.
Okay.
But estriol is the best one, and it can actually be breast protective.
Okay.
Estradiol is probably the strongest one for vasomotor problems. And estriol is in different forms, like it is commercially available. So you can get that through your doctor, or you can see us and we can customize the doses.
What about quality assurance if you get it through a doctor?
Well, those are commercial products.
Okay.
And that's,
so there's a standard of quality?
Right. There is a very good standard of quality, and you can work with that in that framework if you would like to. And there are some good options. Now the pharmaceutical companies are getting a clue, and there is natural progesterone by prescription. There's also 17B estradiol, which is more or less a natural estrogen.
Okay.
So you can get that in a patch form. So you can work with that in that framework, but the caveat is that they don't have custom dosages.
Right.
So if you're doing saliva testing, you are going to have to really play with those commercial products.
So that's the downside, is that you really have to work with someone to adjust yourself, because as you start loading up, you retest in 3 or 4 months, and then you readjust the dosage again.
Right, right.
We're almost out of time, so let's go to this one. Do you feel, Carter, that the majority of women benefit from hormone replacement therapy during or after menopause, and if so, why?
Absolutely. You know, you have your menopause, which is your last period, okay? For 1 to 2 to 3 years, you won't have any problems, but there's silent things happening to your body. There are heart attacks that are going to happen. There is osteoporosis that's going to happen unless you're genetically, you don't have a problem with that. All the other things, your beauty, your sexuality, incontinence, and...
Man, oh man, how come us?
You're just lucky.
Well, you're just lucky. We get to bear the babies and go through menopause. Isn't it grand?
Right. That's right. But really, it's a long-term commitment, and you've got to think that, do you want to do this or not? And you really have to educate yourself, find out the downsides, and then decide.
Right. Well, that's a good answer. And you know what? If you have questions, I have lots and lots of brochures, tons of information on hormone replacement therapy, pros and cons, natural versus synthetic, etc. So you're welcome to give us a call over at Nutrition Consultants. We'd like to give information out. So feel free to give us a jingle. And beyond that, the other thing that you do that I love is that you do additionally, along with the saliva test for hormones, we do the saliva for female hormones. We do the saliva test in conjunction with that for adrenal hormone as well. The adrenal panel tests, just so you know, are tests that we do that address your DHEA, your pregnenolone, and your cortisol levels, which tend to go down also as we age, and can also increase your lack of ability to handle stress well. So that can also be compounded into your formulas, correct?
Right.
Which is good to know about, because everybody is under a lot of stress, right?
It's interesting that, you know, tracking cortisol, women's cortisol don't go down when you...
Ours goes up.
Yeah.
So thank you for being with us. I'm Deborah Arneson with Carter Black, bringing you Health Quest. And until next week, please take good care of your health. And if there's anything you'd like us to talk about, bring a show on, give me a call, let me know. Good night. It was great.